We're going to talk about shoulder problems for anybody that might be experiencing those. But before we get into that, I just want to do a little bit of an introduction for you.
Absolutely.
Way people know who you are, what you do, your experience. They can kind of understand how you are an expert in this field. So I'm going to let you kind of take it away of like your name, your business, where you're located, any little bit of tidbit of information that you want to say, just a description about yourself for anybody who does.
All right, sounds good. All right, so my name is Phil Tokarz. I'm a chiropractor in Rochester, New York. I went to SUNY Brockport first for my undergraduate degree. I got a degree in kinesiology. And then from there, I went to DuVille College and got my 4-year doctorate in chiropractic. I've been a chiropractor now in Rochester for about 3 years, and I now have my own place. It's called Grayson Chiropractic Associates, and it's located at 500 Hellendale Road, Suite 185.
Nice. And that's right down the street from the gym, if I remember right.
Yep.
It's like
very
what,
close, like 5-10 minutes away. Yeah.
Super
very
convenient.
Cool. Absolutely.
Now, one of my members already, Christy, stopped in to see you. She had great things to say when she got done with her consultation or session, if you will. She mentioned that she had a great time, that you're a great expert, and that you helped her out.
Sounds great. Good to hear.
Yeah, great feedback.
Appreciate it.
Yeah, absolutely. I appreciate that. So
yeah, absolutely.
It goes a long way. So and as I mentioned at the beginning of this, shoulder problems can be a reoccurring challenge for some, especially in terms of boxing, because we do use a lot of shoulders in boxing. Obviously, throwing a lot of punches and whatnot, and then other aspects of life too. In general, people might have shoulder issues or injuries in the past. So again, just want to touch on this specific thing because it's something that I hear quite often, and I look forward to our other sessions down the road that we can certainly talk and dive more into other aspects. But this one definitely I feel is most common amongst my members and maybe other people too for it. So I want to start with, I guess, the problem, maybe why it's a problem. I know in terms of boxing and here at Relentless Boxing that some of the form isn't always the best, where some people are too much with their arms and elbows out, so that the entire time that they're boxing, they're holding their arms up versus keeping the elbows in nice and tight and using the body to throw. So I know that's one of the things that proper form is going to help quite a bit. And then in terms of like working out and weights, like bench press, I'm not sure if you have any maybe a tip or if you can just agree or maybe let me know if this is accurate, but what I learned is that keeping the elbows a little bit tighter, just like in boxing, when you're
just
doing
like the punch,
Okay, so when you're doing like a bench press, keeping the elbows in is going to help the shoulders versus flaring them out.
Just preserving that posture, keeping the shoulders back, kind of squeezing the shoulder blades together as you're pushing up can really help you get more power out of it, and you're decreasing the stress on your shoulders.
Gotcha.
For sure.
Perfect. And that's literally it's funny that you mentioned about pinching the shoulder blades back. It was something we had a strength class this morning, working specifically on bench press. Had one of my members, Sam, work on keeping his shoulders pinched as a way to be able to help out with that form. And he's one of my main members who has had a lot of shoulder problems. Not sure if it's because of weak shoulder or proper form, things of that nature. But I'm glad that you were able to reiterate the fact that pinching those shoulder blades together, having that good form, keeping the elbows in is important. And that goes for we do a lot of push-ups here for it, because that's a great exercise to do. It's important to do. But again, it's important because if you're doing the proper form.
Absolutely.
Is there any other, off the top of your head, maybe exercises that you see people typically doing that would involve the shoulder that they might not be doing correctly, like a military press, lateral raises, anything of that nature that you can think of?
I think where I see mostly the big mistakes is just going with too much weight. Even if you're just pressing up dumbbells, if you're going too high of weight, a lot of times you're putting additional stress on the shoulders and you're not able to keep it straight up and down. You're going to be moving a little bit from side to side, wobbling a little bit, and that can put additional stress on the ligaments within our shoulders. So I think the biggest thing really is just keeping the weight light and just making sure form is good. And with all these things, I think the biggest thing is just having good posture during it. You want to keep the shoulders back regardless of what you're doing. If you're doing military press, if you're doing bench press, everything, you want to try to have everything in line. And it really does make a difference.
Gotcha. So in line, just to make sure that we're on the same page and everybody else understands.
Mm-hmm.
So like maybe not arching the back or
Yeah.
like you said, misalignment, whether you're here with a bench, make sure everything's square.
Absolutely. Yeah.
Because
what happens is you start to use other muscle groups that you're not even trying to train, you know what I mean? Just to compensate for the weight or else the poor form. I see that all the time too. And then it can really lead to unnecessary injuries.
Gotcha. Okay. So, and one of the things I've been preaching lately is the amount of like weight, like you were just alluding to, that reduce the weight. Maybe not necessarily taking yourself to failure every time, that hold yourself back a little bit, even if you're feeling pretty good. And progressively increase versus trying to kill yourself every time. Prevent that injury a little bit.
Definitely.
Okay. Absolutely. Now, talking about like focusing too much weight, do you think majority of people that have shoulder problems would focus too much on the chest and not enough back exercises? And
absolutely, we all do. I mean, you're looking at the mirror, you're seeing the front of your body, you don't really see the back of it. So a lot of times you focus more on the front than the back. I think a lot of us are guilty of that, and it can definitely lead to issues in the future, because what happens is we start to really overdevelop this chest, and what happens is it causes our shoulders to roll forward, puts stress on the rotator cuff and other structures in our back, but if we start to balance out and work more of our back muscles as well, you have an even in the front, you're even in the front and back, you have good posture. And that's really the biggest key for sure. And it looks better too.
Okay. Absolutely. Yeah. Just to be able to have those shoulders back.
Absolutely. Yeah.
For it. So now when I've had conversations with some of my members, I've gotten a different like pain points within the shoulder for it. So I've gotten like where the front of the shoulder hurts, the side of the shoulder can hurt a little bit more, and then the back side of the shoulder. And correct me if I'm wrong here, from my knowledge, you got three parts of the shoulder that really create that motion. Where you got the front, the side, and then there's a smaller.
Yeah.
Most people don't even think about it. Almost like a back shoulder portion as well, that you also need to develop and make sure that's developed and not underdeveloped.
Absolutely.
So is there common reasons why like a front of the shoulder, side of the shoulder, the back of a shoulder would hurt?
Yeah. I see a lot of times the front of the shoulder, a lot of people think, geez, I must have like, torn something, or something's really pulled. A lot of times it's just your pec minor that attaches right into here. It can be very tight, which is tight on most people, especially if you're at a desk all day, if you're looking down at your phone all day, we're kind of like hunched forward, and causes those muscles to shorten and tighten. And as a result, that muscle attaches right into your interior part of your deltoid, and it can cause some pain there as a result. So if you do some, release techniques on this, simple like stretches where you're in a doorway, put your hands on either side of the door and kind of lean forward, it can really help. As far as the sides go, a lot of times it's just from tight muscle, and that could be from your upper trap being too tight. I see that a lot. If you can just simply release an upper trap, you take away 90% of the shoulder pain right there.
Okay, gotcha.
And then rear delt, like rear shoulder issues, like a lot of times that can be a sign of maybe the main rotator cuff tendon, the supraspinatus, lies right above the top portion of your scapula. That can get very, that's one of the main ligaments that gets the most wear and tear in our rotator cuff. When you're starting to have some problems with that, you tend to get that posterior shoulder pain.
Okay. And then just kind of going back to that, you mentioned like sitting at a desk and whatnot, kind of going back to Sam a little bit, knowing his profession. I know he does sit quite a bit and quite often. So having those shoulders roll forward or sitting at a desk, that could create that shoulder pain.
Absolutely. And it also puts a lot more stress on that rotator cuff in general too. Just that leaning forward, you're constantly stretching and pulling that all day,
Okay. Yeah. Sure. So not necessarily would it come from working out. It could just be
just lifestyle things. And then you
Okay.
could be just reinforcing it by doing more chest than back. You know what I mean? And that kind of progresses the shoulder pain even more,
Okay.
for sure.
No, that's good to know. And then you were kind of starting to dive into this, and definitely where I think a lot of people are gonna enjoy the meat and potatoes of this
Yeah.
video is the stretches, exercises, things of that nature. Maybe we can start with exercises or stretches, up to you. What
Yeah.
we can do to strengthen the shoulder to kind of reduce the pain.
Hmm.
So I guess, yeah, we'll start with exercises. So what are some of the things we can do? Maybe one exercise that you think is most effective that might help it strengthen and align our
Yeah.
shoulders.
Absolutely. This is something you can use a lot of different things. You can use dumbbells, you can use resistance bands, whatever you're most comfortable with. But I like simple things first. So, just simply like lateral raises,
Okay.
front raises, doing some rear deltoid type things with, you can just kind of be at an angle on a bench, just doing rear delts. Little stuff like that is honestly the most effective, I think.
Okay.
Just keeping it simple. I don't think you have to go and do, you know, 50 pounds each hand, do military press to get strong shoulders. None of that's necessary. You just, use a low weight, good form, and you'll develop what you need to develop and help cut down on injuries for
Gotcha.
sure.
Okay. And now just, I mean, if somebody focuses and everybody kind of knows themselves. So if somebody
Yeah.
knows that they're focusing a little bit too much on the chest,
Yeah.
a good thing to do would be try to do some back
Yeah.
exercise, like,
Absolutely.
face pulls,
Yes.
things that seated
Absolutely.
rows, things of that nature to help
Yes.
pull the shoulder back,
Absolutely.
get that shoulder back into alignment.
Yep. So just more like stretching of the chest and strengthening of the back, you know what I mean? Because
Okay.
a lot of us get something called like upper cross syndrome, where the pecs are really tight pulling forward and their back muscles are weak, and just kind of creates this forward presence that is not good for us in general.
Gotcha. So that's something that's typically seen quite often in order to have a name to it.
Yeah.
For it. So talking about stretching, because there are
Okay.
plenty of different exercises. I do plenty of those back exercises that definitely are in line with what you just said, for
Yeah.
it to be able to hit different parts of the shoulder to really strengthen it.
Mhm.
But maybe from the sounds of it, from what you're saying, is it's not necessarily the strengthening piece, maybe more the stretching piece in some areas and
Yeah.
strengthening in other areas. So
Definitely.
what would you recommend for somebody to be able to do to be able to stretch out, say, a pec, muscle to be able to help with that shoulder pain?
Yeah, absolutely. Yeah, my favorite stretch for just stretching the pecs is very simple. You go into just a doorway, put a hand on either side, and then just kind of like lean your body in for 5 to 10 seconds and just feel a good stretch that way.
Okay.
Then also, if you're at a desk for a long period of time a day, just extend over the back of your desk and just over the back of your chair and just kind of like open things up throughout the day. And then I always tell people too, most of my patients, I tell them, randomly throughout the day for 5 or 10 seconds, just squeeze your shoulder blades together and just hold it, because that's going to help strengthen and reactivate those back muscles. And those are the muscles we need to help keep our posture in the correct form.
Gotcha. Okay. No, that definitely helps out. And
Yeah,
that's some of the stuff that I try to focus on after my classes, hitting the pecs and trying to make sure we stretch enough in that
absolutely.
area.
Yes.
Or whether it's using a wall and stretching out your arm and twisting,
Yeah.
or one and twisting through to
Yeah,
be able to hit this area to loosen that up a little bit.
definitely. And
Go-
you can use like tennis balls, lacrosse balls, and they're great for trigger pointing out tight muscles and not muscle knots. You can do it right into the pec. You can do them anywhere really, and
Okay.
you put it there for about 30 to 40 seconds, and it helps just release the entire muscle. On top of that, massage guns now, the way they've been doing those
Oh
are
yeah.
a great tool to add on also,
Yeah, absolutely.
for sure.
Yeah, something that I'm at some point thinking about adding into the gym to be
Yeah,
able to,
man.
use something of that nature just
Yeah,
to be able to
like a
hit. Now,
Theragun, a Hypervolt, super helpful.
exactly. Now, there's a certain spot that you would say that you can potentially explain over, a video,
Yeah.
that you would say like, hey, this would be the spot to try to hit, for that, like tennis ball or lacrosse ball at all,
Yeah.
further down, up
Um,
further.
yeah, I would put it like, right medially to the shoulder,
Okay.
a little bit below, like right in here. You're gonna get a good That's right where that pec minor is. That's
Okay.
where most of us get the tightness. Right
Right.
here, up here in that upper trap area too.
Okay.
I would say those are the two main areas I would try to hit personally.
Okay.
Yeah.
Absolutely. Now, how long do you think, and this is a tough one, I know this personally myself, because everybody's different. How long do you think somebody should be? I mean, everything should be consistent. Anything that we want to
Yeah.
be able to accomplish, we should be consistent with. But if somebody's trying to be like, all right, if I keep doing this stretch for, 2 days or 2 weeks or this back exercise, how long do you typically see if somebody was able to make sure that they stretched every day, did some
Yeah.
back exercises that it would relieve some of that shoulder pain and kind of go away more permanently? I mean, do you have a time frame at all for anybody that's?
They're doing it every day.
Yeah.
You know, it depends on everyone's case and how severe something is. But I would say within 2 weeks, you should really notice a difference.
Okay.
The key is once you do get those results, to keep with it. I see a lot of people, once they feel better, they fall off the wagon, they stop doing the things that got them to the place where they are now.
Yeah.
So I think the biggest thing is to maintain this. We have to keep doing our stretches, keep strengthening the back muscles, and be conscious of our posture throughout the day. I think that's really one of the biggest things. And,
So it's more.
posture is just super overlooked.
Yeah, true. So from what I'm hearing, it's more about what you do throughout the day than it is what you're doing in the gym.
Yeah.
Okay.
That's just a small portion. I think we're, most of us work, 6 to 8 hours a day. So, you're spending a lot more time working than you are being at the gym, So I think that's really a big thing. And then even when you're at home, on your couch or relaxing, there's certain things that, you should really keep track of with that as well.
Yeah, especially, computer, on your phone.
Yeah, everyone looking down at their phone and stuff. That's just, yeah. Because also with the shoulders, the neck's very involved as well. All the nerves from your neck go and innervate the shoulders and the arms and the hands. So, you can get someone that comes in with numbness and tingling. They don't understand why their arm feels weak or their shoulder feels weak, but really it's coming from their neck. And that's, could be from just looking down at your phone too often. You're putting a lot of pressure on those discs and nerves in your neck. And then that creates that issue.
Yeah. So it's not necessarily a direct answer. Like if your shoulder hurts, doesn't necessarily means it's the shoulder. It could be another muscle pulling in a different direction that you have to focus on. It has nothing to do with the shoulder, but affects it indirectly. And that creates misalignment, that nerve, whatever the case is, that, it's not necessarily, hey, I need to strengthen my shoulder. It's, I got to loosen my chest or strengthen my chest or loosen my back or strengthen my back. And exactly. Indirect muscles that are affecting that.
Yes.
Or neck muscles.
For sure.
Absolutely. Now, if somebody is still having issues with that, and if somebody wanted to come in and talk to you or, have a consultation with you, what are some of the things that they can expect walking into like your office with a shoulder issue of that nature, maybe say specifically the front? What are some of the things that you would do to be able to kind of assess and help them out?
Yeah. I would get a history of the injury, see how long ago this started. Is it a chronic thing? Is it an acute thing? How did it happen? What was the mechanism that caused this thing to happen? And then from there, just go into my orthopedic examinations, kind of to try to count in and count out certain things like, is it really coming from the neck? Is it really just a shoulder issue? Is it nerve related? Is there a pinched nerve somewhere along the line? That's basically my main thing right there. Once I can kind of pinpoint what's going on, that's when I'll start my treatments. And if it's something where I'm not really sure still, then I might send someone out, for additional imaging or else for referral to an orthopedic, depending on what I find in the exam. So that's usually what I do.
Now I know in terms of like types of treatments, you've got a variety of different things that you can do for somebody. Because I know after our conversation, you're like, I can do this, 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 and this. Can you cover some of the it was heat and
absolutely. So if we've kind of ruled in that it's something musculoskeletal, especially in the shoulder, I like to do, a lot of heat, electric muscle stimulation, ultrasound, and then active release. I do a lot of active release type stuff too, just to help get those muscles back to where they should be as far as the looseness. and just getting their range of motion back into normal. That's,
Yeah, absolutely.
and then on top of that, a lot of times just adjusting the spine in corresponding areas to where the shoulder issue might be or something too can really make a big difference. Adjusting the neck and the mid back, along with doing the muscle work to the shoulder, a lot of times can make a person 90 to 100% better just after one session,
Oh, no kidding. Okay.
So
So it's more than just going in and getting my back cracked.
yeah, absolutely.
Right.
And it can affect a lot more things than just your back. You know what I mean? Like, it can help with knee pain, ankle pain, shoulder pain, all that kind of stuff.
Absolutely. Because I know going like before our conversation and meeting you, a chiropractor would, my thought was like, they're gonna, take me and adjust me, but crack my neck or this, that, and the other thing. But what you do is more than just getting those, things
try to do
realigned.
more than just the adjustment for sure.
Right. Focusing on the muscle and why you're out of alignment.
Yes.
Able to, overall to be able to help you in the long term versus just a short term thing, and then having to keep coming back.
Exactly.
Gotcha.
Yeah.
That's great.
I want to work on more than just the bones. I want to work on the muscle as well. I think, it's a 50-50 thing. If you only adjust the bones, but you don't do anything with the muscles, you're still going to have that stiffness and you're going to need to come back a lot sooner. So definitely.
Now, do you give people, I know like I've had like PT sessions before where they kind of give me a little bit of a program or exercises and things to follow. Is that something that you typically do for anybody that comes in?
Absolutely. I have different stretches and exercises I like to give for certain conditions. And basically at the end of the first treatment, I'll give my patients something to work on and you send them home with stuff to do in between sessions. And then after a few weeks, I might, kind of switch what I'm doing with them or give them some more difficult stretches and exercises to do and work on and just keep working on it until they keep progressing, basically.
Oh, okay. Nice. Absolutely.
Definitely.
Anything else that you can think of right now in terms of specific like shoulder pain or anything that you think that we haven't covered yet that would help anybody out?
You know what? That's really it. My biggest thing with shoulder pain still is just posture, looking at someone's posture. Their shoulders are rounded forward, they have forward head carriage,
Yeah.
That's gonna create issues no matter who you are or how strong you are. Down the road is definitely. So my biggest thing is just really keeping your posture good and just like how when you throw a good punch, like you're in line, you got your shoulders back, like you know what I mean? Yes. That kind of thing is really for everything in life that's important,
Absolutely. And kind of going off of that, specifically for boxing, like I mentioned, holding up the elbows, that will create some shoulder pain. So working through making sure we got the proper form, but using more of the body to throw a punch versus using the shoulder, because that's all forward movement. This is all front of the shoulder. Yeah. So that repetitiveness, so we're doing, at least 40 minutes total of boxing for my boxing classes. And then, 20 minutes of boxing, 20 minutes of hit training, 20 minutes of boxing. So 40 minutes in total.
It's a lot.
It's a lot. It's, progressive to be able to keep that shoulder out. So the more we can use the whole body to throw the arm versus just using the shoulders like this versus twisting and throwing can make a huge difference.
Yeah. And what I see with some people is like if they're a pitcher or someone that's throwing the ball or someone that's punching, a lot of times what happens is they'll develop pain that's medial to the scapula, kind of like in between your spine and your scapula. And a lot of times that's because it causes ribs to kind of become misplaced as well. And that's something that I can actually help a lot too, because I can go in and adjust those ribs, put them back into place and make it so it's easier to glide and use your shoulders again and not feel like, restricted when you're trying to extend your shoulders back. Because a lot of times if those ribs are kind of posterior, it can cause pain when you're trying to retract the shoulders back.
Okay, so when you refer to ribs and the shoulder, can you explain that?
So like basically your spine, you have your spine.
Yep.
And then around the spine, like attached into it are your ribs and your rib cage.
Your ribs
from the back all the way into the front.
Yeah.
And those ribs, your scapula lies right above your ribs. Basically, okay. And they glide above the ribs. But if
I
a
see.
rib is kind of posterior, it's going to be a lot harder for those scapulas to glide and retract back. So a lot of times when you adjust that rib cage, you can make things a lot smoother again.
Gotcha.
Create a
So
lot less
literally,
shoulder pain.
your rib cage could be the issue.
Yes, absolutely.
Is there anything that you could say, stretch wise, strength wise, that would help with that?
You know, for something like that, I think the best thing still would be to retract the shoulders and squeeze for about 5 to 10 seconds. You can start adding weights in too. You want to
Okay.
try to strengthen those rhomboids and muscles in the upper part of your back for sure.
Gotcha.
That's
So
what's going to
literally
help the
just
most. And
pulling
that's
them
one of the
forward.
easiest things. You can use weights with that. You can use bands, but you know what I mean? That's the biggest thing.
Absolutely.
For
I know I've
sure.
done that for sure.
Yep.
For that piece. Yeah, that's true. For so that's a good point. As well.
Yeah.
Be able to do that. So, so realistically, to kind of regroup or recover what we talked about, what it sounds like it's pretty basic and simple of, making sure that you're working out a balanced body, essentially balanced in the front, balanced in the
That's
back.
the key.
So this way that you're pulling and pushing in the same, channel.
Yes.
So this way everything's in alignment, and that comes with proper exercises, proper form, not doing too much weight, and then making sure that you're stretching enough. This way you're able to have enough loose muscles to stay in alignment. And then at the end of the day, if things aren't working out, just because really exercise and stretching isn't going to help you, no matter what you do, going to see you'll be able to kind of help with that realignment and get people
definitely
kind of programmed to get them to where they need.
Give them the right stretches and exercises along with the adjustments, just to reinforce what we fixed that day. You know what I mean? And keep it for sure.
And the ribs, I had no idea about that, so that's that was
absolutely.
That makes a lot more sense that you mentioned. That goes
definitely. I see that all the time. So
okay. So what I'll do is I'm going to put your contact information, like your website page, so this way anybody who's interested in learning a little bit more or
sounds great,
they need help, right in the description. That's this way they can go right to your website, reach out, see what you do, see where you're located again. And then from there they can reach out to myself or to you, just to get a little more information and maybe set up a time to get together if they do need.
Absolutely.
Shoulder or knee, hip, whatever the case is.
Definitely. All right, sounds good.
Awesome. Well, hey, thank you very much for the time, Phil. I look forward to having some more talks like this as
definitely
more brought up to my attention, that we can help people out with types of stretches, exercises, things that they can do, and maybe overall just fitness in general too. Kind of come up wise, I'll definitely reach out to you to have another discussion.
Sounds good, Steve.
Have some more information.
Perfect.
Awesome, Phil. Thanks again for the time, and I'll talk to you soon.
Sounds good. Thank you.
All right. Take care.
You too.